Okay, when I started working in this environment, I realized that there was increased number of adolescent pregnancies and school dropout. And also there were myths and misconceptions about family planning services. Most parents thought that these family planning services could endanger the lives of their young ones, and therefore in future they could not get pregnancy. So with the education to the community and also engaging the adolescents and the youths in services and in educating them, grouping them, they are able to realize that they can as well use these methods. They are methods that are safe and are scientifically proven, so they cannot interfere with their future reproductive health. So when the challenge initiative came, it focused on the adolescents and the youth's reproductive health services. And this one, they targeted specific facilities and also the healthcare providers. So after we had been interviewed, we were taken for trainings. That was capacity building for us because the knowledge gap was now catered for. At least we knew that even the 14-year-old girl, the 15-year-old girl could get a future planning because they do not have families. So we talk of future planning. We were also, personally, I was trained to be a mentor in family planning services, and I've nurtured a number of staffs that I came across. They were now I was not the only one providing the long-term methods. It is provided even with the clinicians. Even when I'm away, the services continue. At the same time, we were able to have at some point we were able to have the youth friendly, so they could come on their specific day that they love, which was mostly Sunday, which they feel they are free to air, to express their feelings about their lives and all that takes place around them. At the same time, the TCA also helped us to in documentation. As we presented the data, we could now get they're called the commodities. Yeah, the commodities, the stock out was at least maintained during the period. After the training, we were able, initially we categorized clients like these are family planning clients, these are antenatal clients, these are outpatient clients. But now when we integrated the services, the family planning services in various departments, I find that the client when you start with the client earlier enough, like during antenatal, you talk about family planning, the client becomes psychologically prepared that after delivery she can take a method and these methods are safe. So you find that when you walk along with this client, even after delivery, they are ready to take the immediate postpartum family planning methods. At the same time, there are deaths, maternal deaths that are related to like postpartum bleeding, and this one comes as a result of majorly the clients, our teenage girls who conceive early when the body is not mature enough to receive the baby. So you find that during delivery they come up with complications like the tear, the cervical tear, the uterine rupture, that also leads to their death. So when they are taught about family planning earlier enough, the future planning, they take it, you find that they can stay in school for long. At the same time, they delay the first pregnancies, so there is reduced number of complications that are associated with teenage pregnancies.
Majorly, I do coaching on TCI University to the staffs at the service delivery. The coaching I do, for example, in this facility, they have in-reaches and outreaches. Before they get these clients, there must be mobilization. So I coach on how to conduct mobilization during the in-reaches and outreaches. Integration is going on in this facility, so I coach them on how to ensure that integration takes place. Because if there is no good coaching, even if integration will be taking place, that data may not reach the final point. So there must be a primary source where this data is entered, and finally this data will reach the DHIS. So I coach on integration. I also do coaching on through the TCI University. I coach on the outreaches. How do we conduct this particular outreach, and after during the outreaches, what are we supposed to do, and how do we ensure that data reaches the register and finally reaches the DHIS. I also do coaching on PPFP. As I do mentorship, I also coach on PPFP through the TCIU. So this has really helped us to improve the indicator even for the PPFP, and even we are able to get clients within 48 hours after delivery. The clients are cancelled and then they receive the method, and we avoid missed opportunity.
Yeah, then also I think I say that we've worked with the TCI. You know, it was a 5-year work. We worked very well, and then there were a lot of progress during the time when the TCI was active from 2018 to 2022. Then when it came to 2022, there was that feeling that as a county we were mature enough now to move of our own. We took it very positively, and then we were graduated as a county. And I think from that graduation, we really hold on the high impact intervention, things that can help us move as a county. But of course, we want to appreciate TCI that they did not just graduate us and leave us behind. We have been having a lot of activities going on, like we have what we call the race meeting. That just a race meeting, just an assessment that we do twice a year to see to what extent are we still holding on the high impact intervention. To what extent do we still commit resources to family planning provision? To what extent do we still enhance the capacity of our staff to provide quality family planning services? So we have been doing that one, I think, very, very effective. When we do, we identify areas of gap, and they have continued to support us to also in areas of gap that we identify. Along with that, also, we have been having what we call the coaches review meeting, which the TCI is also still supporting. The time that they were around, they trained family planning coaches, the people that orientate or build the capacity of others so that they provide family planning services. So we have been having biannual coaches review meetings so that we really look, how are we moving? Do we still maintain the high impact intervention that TCI introduced for the time when they're active? And then we look at the gap and we build on that one. And then our coaches also give us a feedback, because our coaches visit facilities and do what we call mentorship. They do coaching to service providers so that they hands on their knowledge. And that one really has been made very easy, because I think TCI, we have what we call the virtual university, the TCIU University, which I think a critical number of our staff have actually been sensitized. They are able to log in, make use of the university, learn, and of course, learn and get new skills on family planning provision. And I think this year, a lot of good things that has come now, that our nurses now can even do courses on TCIU and then get a CPD point that help them even to renew their licenses. And that really has been a motivation to them, because our nurses do a lot of work. So if they go TCIU, register for courses, a number of courses that are provided in TCI University, then they do download the certificate and then link to the nursing council to renew their license. I think that is a big step also that TCI has done. Yeah, and then data. Data is very key for decision making, and I think that is an area that we really want to thank the TCI, because after graduating, they have continued to support us to do annually DQA, data quality audit, whereby we interrogate our data to know what are the gaps, and then what it is that we really need to do so that we improve on our data, and then we also use the data that we have for decision making. So that really has made us to have quality data. I wish even this time when they're around, they will be able to see our primary tools and even the summary tools and do comparison. And I think it will really provide our evidence that our facilities are doing well in terms of data management in the facilities that help us in the decision making. And the quality data that we have, I think, really has been a strength to us. You go to many counties, you find commodities are missing. Our county, I think, commodity security has been there. Most of the family planning commodities are available in our county. And I think that really is one of the reasons that has made us to improve a lot in terms of family planning provision. There's one thing I forgot to add when I'm starting. We talk about TCI supported us to develop the family planning costed implementation plan. But along with that one, we also developed the multi-sectoral action plan for adolescent and youth, which actually, I think Migori, through the support of TCI and other partners, we were the first county that developed that document. And it really helped us a lot to improve service delivery to the adolescent and young people in Migori. And that really boosted a lot the uptake of family planning services among the adolescent and the young people. And I think based on that document, we've done a lot of trainings, especially to our people, so that they become knowledgeable on provision of services to adolescents and young people. Then we also introduce maybe the integration, because not very easy that we can have a model site, youth-friendly services. Let's say the standalone youth-friendly services in facilities. But we adapted what we call integrated approach of provision of adolescent youth-friendly services in our facilities. I think a number of our facilities, they are integrated. If a young person comes, we give them priority for service so that they don't stay so long in the service. And also, we worked with a number of our facilities because of the adolescents, you know, their time, because they are in school most of the time. So we have even facilities extending services to them to late hours, so that even when they come from school for late, then they can reach the facility and get the family planning method. They also have the contact of the facility. They can call, drop-in call, so that they book appointment even in the late hour to get the service. I think that one has been going, and that is really also one of the areas that really has helped us to improve the uptake of family planning services among adolescents and young people.